In Vietnam, cervical cancer is among the leading cause of cancer-related mortality. It is the fourth most common cause of cancer among women and the second most common female cancer among women of reproductive age. According to the World Health Organization, it is estimated that by 2030, the number of cervical cancer deaths is expected to rise to 443,000 globally, more than double the anticipated number of fatalities from pregnancy-related complications.
Thì ung thư cổ tử cung thì thường là không có cái triệu chứng đặc hiệu và không có những cái triệu chứng đặc hiệu. Chính vì vậy mà khi bệnh nhân có những cái dấu hiệu ví dụ như là ra dịch hôi hay là sinh hoạt tình dục ra máu hoặc là có một cái lý do ra máu bất thường nào đó, bệnh nhân mới đến khám, thì khi đấy thì bệnh nhân đã ở giai đoạn muộn rồi. Thì đương nhiên là cái giai đoạn muộn thì lúc đấy khối u nó đã phá vỡ cái cấu trúc cổ tử cung, nó xâm lấn vào những cái tạng xung quanh và nó đã di căn xa, thì phác đồ điều trị nó sẽ không dừng lại ở cái đơn giản là phép chóp và phẫu thuật cắt tử cung toàn bộ, mà lúc đấy mình sẽ phải bổ sung vào tia xạ và hóa chất.
A comprehensive national response to cervical cancer includes prevention, screening, and treatment. A key challenge in fighting the disease is late diagnosis, since over 70% of the cases are detected in their far too late, making management and recovery almost impossible. While HPV vaccine is still at a high price in Vietnam, inadequate health facilities where diagnosis and treatment can take place and the high cost of treatment are all prohibitive factors.
Bệnh nhân ở cái tuyến dưới ấy, khi mà những cái trang thiết bị để phục vụ ví dụ phát hiện sớm hoặc là điều trị nó cũng chưa được triệt để lắm, thì có thể cũng là một trong những cái nguyên nhân mà người ta cứ điều trị nó không có một cái bài bản nào đó, hoặc là phát hiện nó không kịp thời thì điều trị không đến nơi đến chốn, thì đôi khi là những năm gần đây là những bệnh nhân khi đã lên đến bệnh viện ca thì cái nó sẽ muộn hơn và giải quyết nó sẽ khó hơn.
We also thought that it's important to make women more aware of their options, so that they can be an active part in finding solutions and really asking the health system to provide them with the inputs that they need to protect themselves from health.
Early detection and treatment of cervical cancer is not only integral to saving lives and improving women's overall health, it is linked to poverty reductions, education, and gender equality goals. Please join me in the talk with a representative from the World Health Organization, Mr. Patha Basu, from the International Agency for Research on Cancer, to talk more with us how we can implement early screening into our public health system in order to reduce the rate of cervical cancer in Vietnam. Thank you, Dr. Patha Basu, for joining our program today. What are your assessment about the cervical cancer threats? Is there any behavioral and environmental factors that could even more affect it into the threats of cervical cancer for women in Vietnam?
This cancer is because of a virus infection which any woman who is sexually active or married they can get. So especially those women who have sexual activity at younger age, have multiple childbirths at young age, they are more prone, but then cervical cancer can affect any woman. And in Western countries there is something called cervical cancer screening, by which all women are systematically tested at every 3 years or 5 years to find out the disease at a very early stage. But in countries like Vietnam, this screening facilities are still not that well organized, and that is why women still get this cancer and they die of this cancer.
What are some ways that we can reduce the case of cervical cancer in Vietnam?
It can be prevented by two different methods. As I told you that this cancer is caused by a virus infection. The virus is called human papilloma virus, or we call it HPV. This HPV virus infection can be prevented by a vaccine. Now, this vaccine should be given to young girls between 9 to 15 years of age, and 2 doses of the vaccine are required to be given at 6 months interval. And this vaccine has been found to be very, very effective, very safe, and many countries in the world, they are actually giving this vaccine through the national immunization program. So another very, very important method to protect women from cervical cancer is to make sure that women undergo regular cervical cancer screening. By screening, what I mean is that women after the age of 25 years or 30 years should get themselves regularly checked up. Even if they don't have any complaint, even if they don't have any problem, any woman after the age of 25 years, if they are ever sexually active, should have this screening test. By the screening test, we can detect the cancer at a very early stage, which we call precancerous stage, and at that stage, it can be treated by a very simple method. Even hospitalization is not necessary.
A workshop to disseminate the National Action Plan on Prevention and Control of Cervical Cancer in Vietnam for the period 2016-2025 was organized recently in Hanoi by the Ministry of Health and the United Nations Population Fund UNFPA in Vietnam. The action plan put early cervical screening at the top priority, with the aim to enhance accessibility of this service at all public health agencies nationwide.
We know that if a woman gets only one screening for cervical cancer during her life, the overall prevalence of cervical cancer will go down 25%. So, you know, in some countries they do it every 2 years, and that's of course the best. But we will try in the coming years to maybe get to one screening in a lifetime. But even so, that means that millions and millions of women have to be screened. And also women that don't have symptoms, that think that they're perfectly healthy, and they probably are, but we still have to motivate them to go and do this screening. And we still have to build the capacity in the system to be able to work with so many women and then take the samples, and then you have to have the laboratory capacity to look at all these samples, and you have to notify all these people, and then the ones that have positive results or they have lesions or they have HPV, they have to have treatment options. So it is a really challenging thing.
Cervical cancer prevention is prioritized on the global health and sustainable development agenda over the next 15 years. In the coming time, international development partners such as UNFPA, WHO remain committed to providing policy advice and technical assistance for the establishment of a more practical and realistic National Action Plan on Prevention and Control of Cervical Cancer in Vietnam, period 2016-2025. Recently, the Ministry of Health has introduced the Strategic Action Plan for the period 2016-2025 on early screening and preventions of cervical cancer. What are your assessment about this new strategy?
This plan is going to help the provinces to organize the screening program, make sure that the women, even in the rural areas, they have access to cervical cancer screening. And especially it is more important that the women who are positive, they have access to further diagnosis, treatment. So it's quite a comprehensive plan which has been developed by the government, and the government is going to take steps in the near future to make sure that this program is implemented across the country, which is a very, very important and essential step.
What are your views on the early screening and treatment for cervical cancer in Vietnam, maybe compared to other countries in the region?
The government of Vietnam, they have decided to arrange for this screening every 3 years. So women need to have this test done after they reach the age of 25 years or they reach the age of 30 years. Now there are two different types of tests available. One is called pap smear, in which a few cells are taken from the cervix, and then it is examined under the microscope to find out if there are any changes in those cells. The other test is called VIA, which is again a very simple test. We apply vinegar on the cervix and try to see if there is any change on the cervix there. But then more important thing is that both the tests are very simple, they are painless and can be done in few minutes. Cervical cancer screening program is a complex program because it needs a lot of additional resources in terms of trained persons, in terms of some additional equipment, all those things. And the tests are also sometimes expensive. Mainly the developed countries like the European countries, the North American countries, they have been very successfully organizing cervical cancer screening program. But now over time we have better tests, we have simpler treatment methods which has made cervical cancer screening feasible even in low and middle income countries. So now you will find just like Vietnam, many of the countries in Asia, so Bangladesh, Thailand, Malaysia, India, they are also organizing cervical cancer screening for the women. So again, Vietnam is really at the forefront by preparing the strategic document and making sure that the women have access to screening.
What type of program that international partners like WHO or UNFPA would collaborate with Vietnam's the Ministry of Health in terms of implementing early screening into the public health system?
In Vietnam itself, there has been quite a few demonstration programs, what we call pilot programs, to see whether it is feasible to do cervical cancer screening in Vietnam, whether it is acceptable to women, to guide and then to develop the strategic document. And also there has been quite a few good studies to see what is the prevalence of the virus infection in the population. What are the different types of virus which are seen in the cervical cancer patients in Vietnam. So all those things, they tell us how much protection the HPV vaccine is going to give to the women in Vietnam. And the study shows that the vaccine is going to be quite effective. Still the vaccine cost is relatively high, but it is gradually coming down, and I am sure at some point of time it will be affordable and the government of Vietnam will be able to introduce the vaccine as well. One major role of World Health Organization is to produce the guidance documents, which on the basis of the evidences from different research studies, from the programs which are going on in other countries very successfully, which tells the policymakers in different countries what is the best way to organize their program, how they should proceed with their kind of setup. UNFPA again works very closely with the national governments to facilitate many of these things, like developing their national guidelines, making sure that the training of all the service providers is properly organized.
Thank you for all of your valuable sharing today, Dr. Patha Basu. So that's the end of our program today. Hopefully from the program you have a strong message about the importance of early screening and taking HPV vaccinations in order to reduce the chance of getting cervical cancer in the lifetime. And we hope to bring this message to our Vietnamese audience. Any questions and recommendations, please email to sharingvietnam@netvittv.net. Thank you and see you again.